to incentivize good care in those communities. That's a legitimate concern. But the minute you bring up that concern, then that adds money, which means that we then have to find additional dollars. So this is part of just the normal give and take of the legislative process. I'm confident at the end we're going to have a bill that Democrats and some Republicans support. Jake.
Thank you, Mr. President.
Yeah.
You said earlier that you wanted to tell the American people what's in it for them, how will their family benefit from health care reform. But experts say that in addition to the benefits that you're pushing, there is going to have to be some sacrifice in order for there to be true cost-cutting measures, such as Americans giving up tests, referrals, choice, end-of-life care. When you describe health care reform, you don't, understandably, you don't talk about the sacrifices that Americans might have to make. Do you accept the premise that other than some tax increases on the wealthiest Americans, the American people are going to have to give anything up in order for this to happen?
They're going to have to give up paying for things that don't make them healthier. And I, speaking as an American, I think that's the kind of change you want. Look, if right now hospitals and doctors aren't coordinating enough to have you just take one test when you come in because of an illness, but instead have you take one test, then you go to another specialist, you take a second test, then you go to another specialist, you take a third test, and nobody's bothering to send the first test that you took, same test, to the next doctors, you're wasting money. You may not see it because if you have health insurance right now, it's just being sent to the insurance company, but that's raising your premiums, it's raising everybody's premiums, and that money one way or another is coming out of your pocket. Although we are also subsidizing some of that because there are tax breaks for health care. So not only is it costing you money in terms of higher premiums, it's also costing you as a taxpayer. Now, I want to change that. Every American should want to change that. Why would we want to pay for things that don't work, that aren't making us healthier? And here's what I'm confident about. If doctors and patients have the best information about what works and what doesn't, then they're going to want to pay for what works. If there's a blue pill and a red pill, and the blue pill is half the price of the red pill and works just as well, why not pay half price for the thing that's going to make you well? But the system right now doesn't incentivize that. Those are the changes that are going to be needed, that we're going to need to make inside the system. It will require, I think, patients to, as well as doctors, as well as hospitals, to be more discriminating consumers. But I think that's a good thing, because ultimately we can't afford this. We just can't afford what we're doing right now. And just to raise a broader issue that I think has colored how we look at healthcare reform. Let me just talk about deficit and debt, because part of what's been happening in this debate is the American people are understandably queasy about the huge deficits and debt that we're facing right now. And the feeling is, all right, we had the bank bailout, we had the recovery package, we had the supplemental, we've got the budget, we're seeing numbers, trillions here and trillions there. And so I think legitimately people are saying, look, we're in a recession, I'm cutting back, I'm having to give up things, and yet all I see is government spending more and more money. And that argument, I think, has been used effectively by people who don't want to change health care to suggest that somehow this is one more government program. So I just want to address that point very quickly. First of all, let's understand that when I came in, we had a $1.3 trillion deficit, annual deficit, that we had already inherited. Okay. We had to immediately move forward with a stimulus package because the American economy had lost trillions of dollars of wealth. Consumers had lost through their 401ks, through their home values, you name it. They had lost trillions of dollars. That all just went away. That was the day I was sworn in, it was already happening. And we had 700,000 jobs that were being lost. So we felt it was very important to put in place a recovery package that would help stabilize the economy. Then we had to pass a budget by law, and our budget had a 10-year projection, and I just want everybody to be clear about this. If we had done nothing, if you had the same old budget as opposed to the changes we made in our budget, you'd have a $9.3 trillion deficit over the next 10 years. Because of the changes we've made, it's going to be $7.1 trillion. Now, that's not good, but it's $2.2 trillion less than it would have been if we had the same policies in place when we came in. So the reason I point this out is to say that the debt and the deficit are deep concerns of mine. I am very worried about federal spending. And the steps that we've taken so far have reduced federal spending over the next 10 years by $2.2 trillion. It's not enough, but in order for us to do more, we're not only going to have to eliminate waste in the system, and by the way, we had a big victory yesterday by eliminating a weapons program, the F-22, that the Pentagon had repeatedly said we didn't need. So we're going to have to eliminate waste there. We're going to have to eliminate no-bid contracts. We're going to have to do all kinds of reforms in our budgeting. But we're also going to have to change health care. Otherwise, we can't close that $7.1 trillion gap in the way that the American people want it to change. So to everybody who's out there who has been ginned up about this idea that the Obama administration wants to spend and spend and spend, the fact of the matter is that we inherited an enormous deficit, enormous long-term debt projections. We have not reduced it as much as we need to and as I'd like to. But healthcare reform is not going to add to that deficit. It's designed to lower it. That's part of the reason why it's so important to do, and to do now. Chip Reed.
Thank you, Mr. President. On Medicare, there are obviously millions of Americans who depend on Medicare. And when you talk about bending the long-term costs downward, or when you talk about cuts in the current proposal on Capitol Hill, you talk about cuts in Medicare, and they talk about cuts in Medicare, but there are never many specifics. Specifically, what kind of pain, what kind of sacrifice are you calling on beneficiaries to make? And even if not right away, aren't future beneficiaries going to be getting less generous benefits than today's?
No.
And a subsidiary question, what do you think about taking it out of the political realm and giving it to an outside body of experts to take the politics out of Medicare?
Well, on the second point, that's exactly what our proposal is. Called the MedPAC program. By the way, it was originally a Republican idea. I want to give credit where credit is due. The Republican Congress passed a bill that created a panel of healthcare experts to make recommendations to Congress on how we could get better quality, lower cost. The problem is, every year, it would just go on a shelf, and nobody would act on it. So what we've said is, let's give that body some power. Let's require Congress to vote on the proposals that they're making every year. Congress can still reject them, so it's not completely removing it from politics, but they have to reject or accept it as a package. And that, I think, would incentivize and empower important changes. But here's the thing I want to emphasize, Chip. It's not going to reduce Medicare benefits. What it's going to do is to change how those benefits are delivered so that they're more efficient. Let me give you a very specific example. You've heard that as a consequence of our efforts at reform, the pharmaceutical industry has already said they're willing to put $80 billion on the table. Now, why is that? Well, the reason is because there's probably even more waste than $80 billion in terms of how the drug plan in Medicare is administered. We might be able to get $100 billion out or more. But the pharmaceutical industry voluntarily said, here's $80 billion. You know what that means? That means that senior citizens who right now have a so-called donut hole in their plan, where after spending a certain amount on prescription drugs, suddenly they drop off a cliff and they've got to pocket the entire cost, suddenly half of that is filled. That's a hard commitment that we already have. So that's a change in how we are delivering Medicare. But you know what? It turns out that it means out-of-pocket savings for seniors. That's why AARP has endorsed this. Okay. Christy Parson.
You promised that health care negotiations would take place on C-SPAN, and that hasn't happened. And your administration recently turned down a request from a watchdog group seeking a list of healthcare executives who have visited the White House to talk about healthcare reform. Also, the TARP Inspector General recently said that your White House is withholding too much information on the bank bailouts. So my question for you is, are you fulfilling your promise of transparency in the White House?
Well, on the list of healthcare executives who've visited us, most of the time you guys have been in there taking pictures. So it hasn't been a secret. And my understanding is we just sent a letter out providing a full list of all the executives. But frankly, these have mostly been at least photo sprays where you could see who was participating. With respect to all the negotiations not being on C-SPAN, you will recall in this very room that our kickoff event was here on C-SPAN. And at a certain point, you start getting into all kinds of different meetings. Senate Finance is having a meeting. The House is having a meeting. If they want those to be on C-SPAN, then I would welcome it. I don't think there are a lot of secrets going on in there. And the last question with respect to TARP. Let me take a look at what exactly they say we have not provided. I think that we've provided much greater transparency than existed prior to our administration coming in. It is a big program. I don't know exactly what's been requested. I'll find out, and I will have an answer for you. Okay. Juliana.
Thank you, Mr. President. You've said the recent bank profits indicate that there's been no sense of remorse on Wall Street for risky behavior, that we haven't seen a change in culture there. Do you think that your administration needs to be taking a harder line with Wall Street? And also, would you consider going a step further than your regulatory reform proposals and supporting a fee on risky activities that go beyond traditional lending?
We were on the verge of a complete financial meltdown. And the reason was because Wall Street took extraordinary risks with other people's money. They were peddling loans that they knew could never be paid back. They were flipping those loans and leveraging those loans, and higher and higher mountains of debt were being built on loans that were fundamentally unsound. And all of us now are paying the price. Now, I believe it was the right thing to do. As unpopular as it is, it was the right thing for us to do, to step in to make sure that the financial system did not collapse, because things would be even worse today had those steps not been taken. It originated under the Bush administration. We continued it because, whether you're on the left or the right, if you talk to economists, they said that this could have the kinds of consequences that would drop us into a deep depression and not simply a very severe recession. Now, one of the success stories of the past 6 months is that we really have seen a stabilization in the financial system. It's not where it needs to be, but people are no longer talking about the financial system falling off a cliff. We've stepped away from the brink. And that's important, because what it means is there are a lot of companies right now that can go into the marketplace and borrow money to fund inventory, fund payroll, and that will help the economy grow as a whole. The problem is, now that the financial system has bounced back, what you're seeing is that banks are starting to make profits again. Some of them have paid back the TARP money that they received, the bank bailout money that they received, and we expect more of them to pay this back. That's a good thing. And we also think it's a good thing that they're profitable again, because if they're profitable, that means that they have reserves in place and they can lend. And this is America, so if you're profitable in the free market system, then you benefit. But what we haven't seen, I think, is the kind of change in behavior and practices on Wall Street that would ensure that we don't find ourselves in a fix again where we've got to bail out these folks and while they're taking huge risks and taking huge bonuses. So what do I think we need to do? We've got to pass financial regulatory reform. And this is an example of where folks say, well, should the Obama administration be taken on too much? The fact of the matter is that if we don't pass financial regulatory reform, then banks are going to go back to the same things that they were doing before. In some ways, it could be worse, because now they know that the federal government may think that they're too big to fail, and so if they're unconstrained, they could take even more risks. And so there are a number of elements of financial regulatory reform. With respect to compensation, I'd like to think that people would feel a little remorse and feel embarrassed and would not get million-dollar or multi-million-dollar bonuses. But if shame does not work, then I think one proposal that I put forward is to make sure that at least shareholders of these companies know what their executives are being compensated, and that may force some reductions. For banks that are still receiving taxpayer assistance, we have a set of rules that gives us some control on reducing unwarranted compensation. And in terms of the last point that you made, which is the possibility of fees for transactions that we want to discourage, that is one of the ideas that is going to be working its way through the process. I think at minimum, what we want to do is to make sure that to the extent the federal government is going to have to be a backstop, just like the Federal Deposit Insurance Corporation, what everybody's familiar with FDIC, the reason that when you put your deposits in your bank, you can have confidence that they're insured. That's paid for through bank fees. We may need to make sure that there is a similar mechanism in place for some of these other far-out transactions. So if you guys want to do them, then you got to put something into the kitty to make sure that if you screw up, it's not taxpayer dollars that have to pay for it, but it's dollars coming out of your profits. Steve Koff, of the Cleveland Plain Deal.
Thank you. To follow up on Jake's question earlier, sir, so many Americans are concerned that this plan, particularly the government insurance, the public option, would lead to reduced benefits or reduced coverage. Two questions. One, can you guarantee that this legislation will lock in and say the government will never deny any services, that that's going to be decided by the doctor and the patient, and the government will not deny any coverage? And secondarily, can you, as a symbolic gesture, say that you and the Congress will abide by the same benefits in that public option?
Well, number one, not only the public option, but the insurance regulation that we want to put in place will largely match up with what members of Congress are getting through the federal employee plan. That's a good example of what we're trying to build for the American people. The same thing that Congress enjoys, which is there's a marketplace of different plans that they can access depending on what's best for their families. Now, one of the plans that we've talked about is a public option, and part of the reason we want to have a public option is just to help keep the insurance companies honest. If the insurance companies are providing good care, and as it is, they're going to be more regulated so that they can't deny you care because of a pre-existing condition, or because you changed jobs, or because they've decided you're too sick and not a good risk. If with regulation, there's already going to be some improvement in the insurance industry. But having a public plan out there that also shows that maybe if you take some of the profit motive out, maybe if you are reducing some of the administrative costs, that you can get an even better deal, that's going to incentivize the private sector to do even better. And that's a good thing. That's a good thing. Now, there have been reports just over the last couple of days of insurance companies making record profits. Right now, at a time when everybody's getting hammered, they're making record profits and premiums are going up. What's the constraint on that? How can you ensure that those costs aren't being passed on to employers or passed on to employees, the American people, ordinary middle-class families, in a way that over time is going to make them broke? Well, part of the way is to make sure that there's some competition out there. So that's the idea. Now, to get to your original question, can I guarantee that there are going to be no changes in the healthcare delivery system? No. The whole point of this is to try to encourage changes that work for the American people and make them healthier. Now, the government already is making some of these decisions. More importantly, insurance companies right now are making those decisions. And part of what we want to do is to make sure that those decisions are being made by doctors and medical experts based on evidence, based on what works. Because that's not how it's working right now. That's not how it's working right now. Right now, doctors, a lot of times, are forced to make decisions based on the fee payment schedule that's out there. So if they're looking and you come in and you've got a bad sore throat, or your child has a bad sore throat, or has repeated sore throats, the doctor may look at the reimbursement system and say to himself, you know what, I make a lot more money if I take this kid's tonsils out. Now, that may be the right thing to do, but I'd rather have that doctor making those decisions just based on whether you really need your kid's tonsils out, or whether it might make more sense just to change. Maybe they have allergies. Maybe they have something else that would make a difference. So part of what we want to do is to free doctors, patients, hospitals to make decisions based on what's best for patient care. And that's the whole idea behind Mayo. That's the whole idea behind the Cleveland Clinic. You know, I'm going to be visiting your hometown tomorrow to go to the Cleveland Clinic to show why their system works so well. And part of the reason it works well is because they've set up a system where patient care is the number one concern, not bureaucracy, what forms have to be filled out, what do we get reimbursed for. Those are changes that I think the American people want to see.
What about yourself in Congress? Would you abide by the same benefit package?
You know, I would be happy to abide by the same benefit package. I will just be honest with you. I'm the President of the United States, so I've got a doctor following me every minute. Which is why I say this is not about me. I've got the best health care in the world. I'm trying to make sure that everybody has good health care, and they don't right now. Lynn Sweet. Oh. Well, I said Steve Koff, but he just stood up, huh? Well, that's not fair. Shame on you. All right, get in there real quick, Steve.
Cleveland connection, so I appreciate that. You cited the Mayo Clinic and the Cleveland Clinics as models for the delivery of health care in the past. The Mayo Clinic, though, has some problems with the House proposals, saying they're not focused enough on patients and on results. What do you expect to achieve tomorrow by going to the Cleveland Clinic, which hasn't stated an opinion? And are you expecting some form of endorsement from the Cleveland Clinic?
I'm not expecting an endorsement. The Cleveland Clinic is simply a role model for some of the kind of changes that we want to see. I think it's important to note that the Mayo Clinic was initially critical and concerned about whether there were enough changes in the delivery system and cost-saving measures in the original House bill. after they found out that we had put forward very specific mechanisms for this MedPAC idea, this idea of experts getting the politics out of healthcare and making decisions based on the best evidence out there, they wrote in their blog the very next day that we actually think this would make a difference. Okay? All right, I tried to make that short so that Lynn Sweet would get her last question in.
Thank you, Mr. President. Recently, Professor Henry Louis Gates Jr. was arrested at his home in Cambridge. What does that incident say to you, and what does it say about race relations in America?
Well, I should say at the outset that Skip Gates is a friend, so I may be a little biased here. I don't know all the facts. What's been reported, though, is that the guy forgot his keys, jimmied his way to get into the house. There was a report called into the police station that there might be a burglary taking place. So far, so good, right? I mean, if I was trying to jigger into, well, I guess this is my house now, so it probably wouldn't happen. But let's say my old house in Chicago. Here I'd get shot. But so far, so good. They're reporting, the police are doing what they should, there's a call, they go investigate what happens. My understanding is, at that point, Professor Gates is already in his house. The police officer comes in. I'm sure there's some exchange of words, but my understanding is that Professor Gates then shows his ID to show that this is his house. And at that point, he gets arrested for disorderly conduct, charges which are later dropped. Now, I don't know, not having been there and not seeing all the facts, what role race played in that, but I think it's fair to say, number one, any of us would be pretty angry. Number two, that the Cambridge police acted stupidly in arresting somebody when there was already proof that they were in their own home. And number three, what I think we know separate and apart from this incident is that there is a long history in this country of African Americans and Latinos being stopped by law enforcement disproportionately. And that's just a fact. As you know, Lynn, when I was in the state legislature in Illinois, we worked on a racial profiling bill because there was indisputable evidence that blacks and Hispanics were being stopped disproportionately. And that is a sign, an example of how, race remains a factor in the society. That doesn't lessen the incredible progress that has been made. I am standing here as testimony to the progress that's been made. And yet, the fact of the matter is that this still haunts us. And even when there are honest misunderstandings, the fact that blacks and Hispanics are picked up more frequently and oftentimes for no cause casts suspicion even when there is good cause. And that's why I think the more that we're working with local law enforcement to improve policing techniques so that we're eliminating potential bias, the safer everybody's going to be. All right? Thank you, everybody.